guys know, we are here for our Frankly Speaking About Cancer, Making Treatment Decisions presentation. So tonight we'll kind of be doing some introductions like we're already doing, but then we're also going to be talking about treatment planning, setting goals, treatment options, caregiving, questions and answers, of course. This was medically reviewed by Thomas LeBlanc, MD, in April of 2020, so this year. And then, of course, our workshop disclosure. So this program was developed by Cancer Support Community. They developed the content independently and then had outside medical and psychosocial experts review it. CSC has final control over the content of our programs, and the program is generously sponsored by Pfizer Oncology. The presenter was engaged by your local Cancer Support Community /Delta, so she was engaged by me. And then our presenter disclosure. So this is Lynn. Lynn has no financial responsibilities or affiliations to disclose and is not being paid by Pfizer. She's graciously taking some time out of her evening to help present tonight. So I will hand it over to Lynn. Lynn, thank you again for being here tonight. We so appreciate it to provide this wonderful education program, and I'll hand it over to you.
Okay. Thanks, Rachel and Cancer Support Community for asking me to present on this topic. It's very near and dear to my heart. I just want to let you know before we get started on the presentation, my background. So I've been a nurse for over 25 years, working mostly in the surgical setting, inpatient and outpatient, but until just about 5 years ago. And then cancer came knocking at my door. And so in 2015, I was diagnosed with triple-negative breast cancer, and my treatment consisted of chemotherapy, bilateral mastectomy, reconstruction. And although I was a nurse and should have known everything that was going to happen to me, I was clueless. And it was a cancer world that I was very foreign. My cancer journey has taught me many life lessons, both during treatment and beyond. Once I recovered from treatment, I was completely on a different life mission. So I entered the world of oncology nurse navigation. So I did not have a nurse navigator in my journey. And when I found out such a thing existed, I was all on board. That whole idea of having an advocate with you by your side through treatment was very interesting to me. And I thought it might have helped a lot of the issues or anxieties I might have been having. But ultimately, it does lead to communication and confidence in your care team, which is what we're going to get into here. But I did that nurse navigator role for a few years, but then survivorship became my newest mission, and I am now the survivorship program coordinator for Community Health Network. And so our program focuses on making sure you get those tools to get you into that new normal, and we walk that walk with you, making sure you have those resources and you know what that means. So to get started, we'll go over some objectives. So we want you to know what choices you make are going to be right for you. Be knowledgeable about your diagnosis and treatment options. Just don't say, I know I have breast cancer, but that's all I know. Or I have colon cancer and that's all I know. Ask questions, advocate for what you need, and be knowledgeable. And know that there are great resources out there. Cancer Support is one of them. So to get started, the next slide is going to go over some newly diagnosed tips. You and your loved one may have been diagnosed. Sorry, I shouldn't read the PowerPoint and I don't want to. So cancer does not define you. So educate yourself, ask questions of your care team, research responsibly. Can't say that enough. Don't go blogging. It can be a dangerous world out there. Get support, and some of these blogs are very supportive, but their journey that is not your journey. And keep that hope and courage. Keep that positive mindset. Focus on what you can control, which may seem like nothing right now, especially if you're just newly diagnosed, right? But there's a lot that is within your control. Next slide. So treatment planning basics. The topics you want to discuss with your medical team really is all-inclusive. They need to get to know who you are. I can't stress this enough. They need to know not just how old you are, but like if you have transportation needs, your overall health. If you're a diabetic, they need to know. Available resources and support systems. You want to know what the cancer center you're being treated at and offer to you. Your point in life is very important. What your family life looks like, what your work situation looks like. You want to make sure that they know all those things because those can reflect and be added into and intertwine with your treatment. Treatment isn't the one thing to control you here. Next slide. So again, I will focus on the empowerment approach by setting goals that you can. Plan that strategy. So when I say a strategy, be realistic. Don't be an overachiever. I know I wanted to work through treatment, and my oncologist basically said, sure, that's no problem. But I really should have not been as hard on myself as maybe I was. You set those realistic goals and you'll find out what they are, and they change as the treatments go, as the journey goes. Ask for help. Don't do it alone. Those resources again are key, and we'll kind of go over some of what those are. But they're within the cancer center that you are getting treatment at. Next slide. So it's this whole concept of shared decision making that you and your healthcare team need to get on the same page. I have sat in many of consults with patients, and they really let the physician take the lead and don't ask questions or don't think that the things coming up in their life are of any importance. The most important thing is their cancer, and they want to put all life on hold to make those treatment things happen. But I'm here to say that you can it's not impossible to say, I really want to go to my kid's ball game, or I have a trip planned, and is that possible? And your care team is going to make that possible, if at all. If they caution you that it's not in your best interest, it's really with your safety and your health in mind. But they really, I haven't met an oncologist or a care team yet that isn't willing to make those quality of life and those important life milestones part of the treatment plan. Next slide. So all about setting your goals. What's the most important thing for you to be able to do? And what's going on in the lives of others around you? Do you have an aging parent? Do you have young children? Do you have a graduation of a child coming up? Or work? Do you have to work full time? Can you adjust that schedule? How flexible would your workplace be? And can you get any help at home with tasks? Maybe your kids are older and they are welcome to doing chores and things like that to help you. But one of the examples I want to bring up is as far as setting these goals and letting those important things be known is I covered a patient that he catered events and was very entrenched in the Indianapolis Motor Speedway. The month of May, you can imagine, was very, very important to him. And so he was diagnosed in the month of May, early in the month of May. But the thing on his mind was just cut this thing off, and I need to get back to the race. It's going to be happening in a few weeks. I don't have time for this. But he also, when he found out what the treatment recommended was going to consist of, he was very hesitant because he saw how that was going to interfere with his plans and his life and what was really, truly important to him. And he listened, but then he said, I don't want to start treatment till after race day. I need to see this through because I don't know what the rest of my life holds. I want this race. I want to do this event. And so we made sure that we came to an agreement that he would get all the testing that he needed to get done, and maybe get his port placed and things like that before race day. So, and as promised, after race day, there he was, ready for treatment, and with all kinds of race stories to share, as you can imagine, along the way. But I'm just trying to emphasize the point that your goals are important to the care team, and it isn't just about, I need to get this treatment started in 2 days. That in this big scheme of things does not matter. A day or a week is not going to make a difference. Next slide. So some other goals is, are you getting the support you need from your community? And are you able to stay active or involved in your community, whatever that may look like? And then are you taking care of yourself spiritually and emotionally? And what else is important to you? These things, like I said, just ask these questions of yourself. Know what is important and don't be afraid to speak it. You have to have confidence in that care team, and you have to know what's important to you. A lot of people, a lot of the chemotherapies, for example, you lose your hair. There are ways to, perhaps not lose your hair, or planning and knowing if that's important to you. It's all a part of this setting your goals. Next slide. So, and those goals are just intertwined with your values. So if you're active with your family, you want to be healthy enough to attend a graduation. Nobody wants side effects, so as few as possible. Some people say, I don't care what the treatment is. I do whatever you need to do. I don't care the cost. But some people, that cost is really important and going to make a make or break decision for them. So they need to know that. And also some people, as soon as they're diagnosed, interestingly enough, want to say, what can I do to help to advance science and do those clinical trials? They want to know from the start. So, it's what those things that you value, and that care team is going to be with you for, up to a year even. So you have to get pretty intimately involved. Next slide. So some helpful tips is, of course, breaking the process into smaller bites, one step at a time, one day at a time, one treatment at a time. Think about those goals, your life, and your current situation, and work with your doctor to create that written treatment plan. Now, the doctors do have a written treatment plan, but it's all based on recommendations and evidence-based research. What isn't in that plan is, okay, I need to coordinate this so that I do this on my treatment on a Wednesday, so that I know that I have the weekend to recover, and then Monday I'm back at it, because I know that those days are important, and I'm going to feel bad. So I want to have that in my control. That's where your part of the treatment plan comes in, not the doctor's treatment plan. He's got the drugs, he's got the radiation, the whatever, but you have the driver's seat. Next slide. So when you're first diagnosed, it's real important that you understand what that diagnosis is. So the doctor should tell you what kind of cancer you have, write it down. If you don't understand, ask questions. Get copies of your pathology, your imaging, your testing, anything that was related to your cancer, and even a doctor's consult note in case you want to get a second opinion or you want to reference that thing, anything later on. And ask your doctor what they base their treatment recommendations on, and talk to your care team. And this includes that nurse navigator, if your institution has one. They can help answer questions. Talk with others who have had cancer, especially those with a similar diagnosis. And I'm going to give big caution flag here. So if you talk to someone and they say, I've had breast cancer, you might want to ask a little more detail, because you may have breast cancer, they may have breast cancer, but they're completely opposite types, completely different treatments. And you may think that, well, why am I not getting what they got? Because really, your doctor knows that that treatment isn't applicable to your type of cancer, your type of breast cancer, for example. So I caution you with that. But in the next breath, I say, listen, because these people have gone through maybe chemotherapy, radiation, immunotherapy, surgery, and they have lots of helpful hints to share, lots of tips and tricks that can get you through, and encouragement, encouragement, encouragement. So if you base what you talk to them about differently and not hang your hat on exactly the same treatment, they can be a great resource for you. Next slide. So when you go into that first appointment, have a list of questions. Since you're getting this PowerPoint, this will be great to kind of have along, but you want to know the type of cancer, the stage. The stage of cancer is not the grade. So what does that mean? The stage of cancer does determine treatment, and not just what type of treatment. It might be surgery and surgery alone. It could be chemotherapy before surgery. It could be chemotherapy, radiation, and surgery, and in what order they go in is really dependent on that stage and that type of cancer. And then what symptoms that you might experience. This is everyone's best guess, but there are some known common symptoms that you can expect with certain chemotherapies and radiation. For sure, you know you're going to have some skin issues. And what type of tests do I need? So you may have to go and get further scans or blood work to help really diagnose what stage you are. And then where can I get a second opinion? It amazes me that a lot of people are afraid to ask this question. And I would say that if your oncologist can't answer this, I would think twice about that, because second opinions are just that. They should be welcomed, and it gives you confidence and trust in your care team. Next slide. So your choice of doctor and cancer center can depend on several factors. So your cancer type and stage. So some oncologists do specialize in a particular type of cancer, so that might determine who you might see in that network. Your personal preference. So important here, you got to click with that oncologist and that care team, and you have to be confident in that care team. If you aren't, then you might think twice. You might say, okay, here's the second opinion. He doesn't get me, or I don't get him. Your insurance coverage. So unfortunately, insurance is what it is, and sometimes they cover certain networks and some they don't. Logistics of transportation, distance, and cost. So with this, the navigation, the social work, a lot of the other parts of your care team we'll discuss later can help you with these barriers. So while you think logistics might play a role, there might be ways that you can still see that provider if you want to. You just have to iron out some details first. Next slide. So these are some terms you might hear as part of that care team. So medical oncologist, this is usually the person that will give chemotherapy or monitor you in survivorship, even if there's not a treatment just for surveillance or scans. The nurses that are there with treatments, radiation or chemotherapy. Surgeons, and then some surgeons are surgical oncologists specializing in a particular type of surgery. So obviously breast cancer surgeons, we've got colon cancer oncologists, pathologists. So those are the people that you don't see, and they are reading your pathology and looking at those slides, but they have very important work to be done. Radiologist, again, doing your scans. And the radiation oncologist is the person that's going to be, you're going to be seeing to get radiation if that is recommended for you. And with that comes a group of people, a dosimetrist, radiation therapist, and a medical physicist. They all do that behind the scenes mapping of beams and things. And then most importantly, your general practitioner. A lot of people say that they just kind of forget about their family doctor. They're focused on their cancer treatment and they don't talk to their family doctor during this month, year, or whatever that they're going through treatment. And then they try to regroup with them, and there's so much to tell, so much to know. So I always say keep them informed when you're first diagnosed. Let the office know, let them know who you're getting treatment from. Make sure that your oncologist is copying records to them so that they're kept informed along the way. And go see them. You can get an annual wellness visit even during cancer treatment. It just may look a little different. The social worker, and it's not mentioned on this slide, but it is the nurse navigator. Again, another role that's near and dear to my heart. Our main goal as nurse navigators is we're kind of that glue, kind of the hub and the wheel of that's right with you during your cancer journey. So we're making sure that the barriers to any care that you might receive are addressed and hopefully busted if we can at all. And we make sure that those treatment plans that you and the provider has decided on are carried out in the right steps and in the right order that they should be. More members of your care team is the next slide. And that's the pharmacist, so the one that would be mixing up your chemo or even chemo pills. Your psychiatrist or psychologist. Many people go through treatment without any behavioral health or mental health. I wouldn't say issues because there's definitely issues, but don't have one to guide them this way. And I would recommend that. Everybody needs a little mental health tweaking, even outside of cancer. Registered dietitian. So these folks are wonderful. They can get you a lot of tips and tricks on how to get through things that might, like radiation to the neck, could cause some swallowing issues. So what foods would be good for that? Colon surgeries, there's certain foods that you want to avoid. So they can guide you on how to make sure you keep your protein levels and your nutrition the best it can be. The plastic surgeon, so they come in most commonly with breast cancer, but they have done other modalities, but they come into, that's the one that off the top of my head when they would enter the picture in the oncology realm. Rehab specialists, so your physical therapist, your occupational therapist, your speech therapist. So they're all part of this wonderful healthcare team. And if you don't know they exist, ask questions. They're there, I promise you. If you need home health, there are certain times that you might qualify for that. And if you need an aid in your home, ask about it. Hospice care, there are providers if there is hospice care, and the clergy. So that kind of wraps up that care team. And then next slide, you're going to be preparing for that doctor visit. So again, I mentioned this again, write down those questions before you go in. It says don't record the visit without asking or discussing with your doctor. Very true. However, I highly, highly, highly encourage you to do this recording. So ask the doctor, and they should be very willing for you to record them. And I would say bring a friend or family member with you to take notes. It's always good to have that extra set of ears. In this COVID world we're in right now, hence we're all virtual. So a lot of times you can, if you have a smartphone, you can bring them in that way. And they can be sitting even in the car in the parking lot and be phoned in on the conversation or FaceTimed. But I highly encourage that too. That's the way to stay connected. Also important is letting your doctors know of all of your medications, and that's a capital ALL. That includes over-the-counter vitamins and supplements. These things can interfere and can even minimize some of the treatments you might receive. So, or cause harm while you're receiving treatment. So it's important that they know exactly what you're taking and make sure that you get the advice and follow that advice that they give you. Next slide. So what can you do? So try to stay focused on what is happening right now rather than trying to make all the decisions at once. I know when I was first diagnosed with the type of cancer that I had and the treatments that were recommended to me, it felt very much like a hurry up. And I felt like time was of the essence. And I really, really, really should have taken that moment to breathe and talk with my care team. And by care team, I mean my family. Know what resources are out there and know what assistance I could get ahead of time. And know that if I waited a day or a week to get other things in order, like talk to my workplace or talk to my family, it wasn't going to make a difference in my care. A day or a week is not. If it does, your doctor will tell you that. But sit down with a financial or insurance counselor at the cancer center. Oh, this is key because it's a new world with insurance. And if you were like me, you barely used that system prior to diagnosis, and you're going to get intimately involved with your insurance company now. So it's good to know what to expect and not fear what might come and know what assistance is offered for you. Again, understand that things and how you feel about them will change. One of the things I like to bring up is one of the things that I feared is my hair, losing my hair. And I thought that would be actually one of the worst things to happen to me and scariest. And oh my gosh, I couldn't go outside. It was actually very humorous. It caused the bald head caused a lot of laughs during my treatments, and watching it grow back and having fun with my nieces with turbans and scarves and wigs was all part of that. But and I never thought, I mean, I've trimmed my husband's hair, but I have never had him shave my head. So that was definitely role reversal there. So that was interesting, and I was laughing and crying at the same time. So understand that things that you think and how you feel about them. Take advantage of available resources. So resources are numerous. In our community here in Indianapolis, we have Little Red Door, Cancer Support Community. We have like Gilda's Club was, I think they're mostly in Southern Indiana, but there's also the internet. So when I say internet, I mean American Cancer Society, cancer.gov, Cancer and Careers is another good one. They have really good evidence-based resources and information for you. Next slide. Okay, so making that decision is all part of all of these factors we've been talking about, right? So what's your goal? Is it, and know what the goal is. Is it curative or is it palliative? And when I say that, I mean, are they hoping that this treatment will cure your cancer, or are they hoping this will put those cancer symptoms and issues and maybe shrink tumor, but it's not going to cure it? Important words to know. Potential benefits. So if you get this treatment, are you going to have less pain? Maybe it's a tumor in your bones. The type and severity of side effects. Again, you know, I wouldn't say that side effects should be a basis of your decision, but I know for some it can be. Especially the older you are, I think, you know, maybe you don't want to go through all of that, and that's a discussion to have with your doctor. So maybe there's a better treatment option for you that might not have as many side effects. Worth a discussion. And the reasons behind that treatment choice is something that your provider should always be able to let you know. Cost is a little more elusive, but we're getting better in the realm of that. As far as I know, a lot of places are, I know community in specific is has cost analysis, and you can tell them your insurance and your provider, and they can kind of let you know what a particular scan or a ballpark of what that might cost and what your responsibilities might be. But I caution you on that too, that you should not just go by what they have said, but also check with your insurance company directly, because they don't know if you've met deductible or not met deductible, and your insurance company does. So next slide. So guideways versus pathways. There's two basic approaches to developing these standards called guidelines and pathways. They help the doctors make those informed treatment decisions, and they help you. They're evidence-based, so people have been there and done that. So we have to learn from those that have been there and done that. No matter what stage of cancer they were, or what type of their cancer, all of that goes into some huge database and is analyzed. There's clinical trials too, but you want your provider to be well researched and well read, and know those evidence-based standards. And next slide, we'll go into guidelines. So they're based specifically on subtype, genomic profile, and the stage. So one of the most common that you might hear your provider mention is NCCN guidelines. You can look that up, and they have great patient information. It's just not for the provider. They do have things in patient speak. There are panels consisting of cancer specialists, experts in psychosocial care, and patients. All that information makes up those guidelines. So they even have guidelines for survivorship, and those late and long-term side effects and how to manage those in survivorship. And this is all research-based, so they know that neuropathy, and here's some examples that really do help this particular medication or this particular exercise. So those are all part of those NCCN guidelines. And the cost of treatment doesn't typically impact those guidelines. It's just based on research and cause and effect. Next slide. So pathways, they're more shown to improve the quality of care by ensuring that patients receive the most proven therapies rather than unproven or expensive ones. So you might hear your insurance company say, I'm not covering that, and it's not because of necessarily they don't want to. It's that maybe it's not been proven to show its efficiency or effectiveness just yet. So but they can include those preferred drug choices. Oncologists can receive financial incentives for adhering to the pathways of those drug choices, but most commonly you're going to hear about the guidelines more than pathways. Next slide. So I feel like this is a little repetitive, but questions to ask about treatment options is getting ready. So why are they recommending this treatment over something else you may have heard or something else somebody may have told you? Ask those questions. Again, the goal of treatment. What are the benefits and risks of each treatment? So you want to hope that the benefit is you shrink the tumor goes away, kills those bad cancer cells. The risks of the treatment might be that you might be more prone to blood clots. So we have to monitor those clotting factors. How can you prepare or manage for those side effects is what they'll guide you on. So maybe they not just monitor lab values, but they caution you to, your levels are a little low, like your white count or whatever, maybe avoid crowds so you don't get sick. So those are the kind of questions, and that brings something into your control too. And there's more questions. So how often, next slide, sorry, how often will given and where. So some people get to take a pill once a day and that's all. Some people have what they call cycles of chemotherapy, and they're given once every 2 weeks or once every 3 weeks, once a month. And it's given at a cancer center or an infusion center. And that's another thing, like how it's been given. So, and how long does the treatment last? How long are you going to be there? If it's a case of chemotherapy, you'll be there a while. If it's a case of radiation, you're there 10 minutes. It's going to take you longer to undress and redress than it is to have the actual treatment. But it is daily, so usually with those radiation treatments. So while it's not a long time factor, like you're not there 3 to 4 hours in the case of chemotherapy, you might be there for just 10 minutes, but you're there 5 days a week. And does the facility where treatment be given offer resources for emotional support? Again, this is where the social worker, nurse navigator come in handy and are very key. Next slide. So treatment options. These are the treatment options that you'll hear the words for, and I'll explain those in just a minute. But most of these treatments, you might only have one of these. You may have all of these, but you'll probably, obviously, at least have one. So the first one I want to go over is chemotherapy. So the next slide says chemotherapy involves the use of drugs that destroy cancer cells. It also can destroy those healthy cells, but that's the mechanism that it works. And because of that, it's called systemic therapy. So it's given IV, it's given pill, it's given injection. It can be applied directly to the tumor, but it is systemic in nature. So the effects are going to go throughout your body and work on that same way. One of the things I'd like to say about, I received what's called neoadjuvant chemotherapy. And so my tumor was not there at the time of surgery. It was a complete, what they call a complete response. So it gave me some pause and some confidence that, well, if it killed that entire tumor, if there was one lone cell or 5 lone cells floating in my body, it was destroying the same ones. So just that's what I mean by systemic therapy. Radiation therapy is localized. So it can be external, so delivered by that machine with those rays and those lovely smart people, that those dosimetrists and stuff that figure all that out. And that's the one that's usually once a day for several weeks. I mean, like 6 to 8 weeks. It's not just 1 or 2 usually. Internal radiation, though, is when they actually put those radiation sources in your body, like a seed or a capsule or a liquid. And because you're kind of radioactive, you may stay inpatient, or you may have to stay in your home. In the case of like thyroid cancers with those radiation pills and liquids, that they have to stay in their home and be kind of confined to one particular bathroom in their house or something. But they will caution you on that. That is localized treatment. So it's not going to affect your whole body. It's just going to affect just that spot where the tumor is. And the next treatment mentioned is surgery. Most common form of cancer treatment. It can be used in combination or alone. Like I said, you might get all of those lovely treatments that we are listed here. But surgery is used in diagnosis. So even with a biopsy, you have what they call a clinical stage. And then with surgery, after treatment, or even if it's the first line, the first thing that you do is surgery, it determines that what they call pathological stage. So it determines what cancer you have. It determines how the cancer has developed, and it determines treatment. So it's trying to stop that spread. So that's when you hear, okay, we got the tumor out. We checked the lymph nodes, for example, and the lymph nodes the sampled were clear. So we know that it hasn't spread, because that's the main channels that it spreads to. Debulking is reducing that tumor that can't be fully removed. A lot of these are like gynecological in nature, those abdominal surgeries. Reconstruction restores that function and appearance of the body part, like example, the breast, affected from the cancer treatment. The next slide is targeted therapy. So this is given through IV, pill, or injection. The one I want to bring to mind most at the front of my mind is in the case of prostate cancer or breast cancer, where hormones are the drivers, the ones that the things that feed those cancers. Those are called targeted therapies because they can give hormone blocking pills to kind of shut that down and starve those cancer cells that are feeding off of that. So that is a targeted therapy. A lot of cancers don't have targets. So this is one thing to discuss with your doctor if you truly have a cancer type that has a targeted therapy. The next type of treatment is immunotherapy, and this is using your body's natural defenses to identify, attack, and kill cancer cells. It's given IV. It's usually very well tolerated. It doesn't have near as many side effects as chemotherapy. But these regimens you actually could be on for quite a long time. There's some immunotherapies that go for a year, or 12 cycles, which is monthly. But anyway, those work directly with your body's natural defense system. So some of the side effects that you can have with immunotherapy is really like your body being confused in that response. So you might have some extra inflammation or more prone to an infection. And then the next slide is palliative care or supportive care. So I want to go right down to the bottom line. Palliative care is not the same as hospice care. So one of my mentors, one of my dearly beloved nurse navigators who led that field, Lily Shockney, she likes to refer to the palliative care folks as quality of life coaches. And that's exactly what their goal is, improve that quality of life. So if pain is the problem, they try to get that pain under control. If depression or stress or anxiety is the problem, they try to relieve that symptom to make treatment better palliative. So palliative care, not hospice care. Next slide. Questions to ask during treatment. So this is a really good slide. I think, this is something that you should take to your consultations that you have with your care team. You want to know the symptoms and side effects that are affecting me most. You want to let them know what those are. So is it nausea and you just cannot eat? And it's interfering with your life, obviously, because you can't eat, you have no energy. Or is it neuropathy and you're having trouble with your step, your gait, you're stumbling? They need to know how it's interfering with your life. And what can you do to manage the symptoms? So that's the question for the doctor. So is there a medication that can be used, or any other tips or tricks that they might suggest? Complementary therapies or supportive palliative care may help manage some of those symptoms and side effects like I mentioned. And you can ask if a referral could be made or is warranted at this time, or if it's something that they can manage. Don't minimize those integrative complementary therapies in helping your treatment side effects. And I think we'll go into that a little later. Next slide. So coping with those side effects. I like how it says you may have side effects from treatment. You will. It just depends on what they are and what on the scale, how much they really bother you. Track your side effects. And this I stress to all of my patients is from day one, track how you do. So in the case of chemotherapy, especially important to keep a journal. So write down how you feel, the severity of that nausea that you may be having, the numbness in your tingling. Maybe it's there for a day or two and then it goes away for the rest of the days until your next treatment. With radiation, those are usually more of a cumulative kind of side effect, that skin irritation, but keep an eye on it. Let them know the severity and keep track of all that. And those life impacts. So what I tell my patients is when you do a cycle of chemo per se, you can write down how you feel on day 1 through day 14. And then you'll notice when you go back for cycle 2, day 1 through day 14 of that next cycle is going to kind of be the same. You know, there's always an asterisk behind all of that. It could be different, but it probably isn't. But anything can happen. But then you can plan. So that's the beauty of that, is so you know that, oh, wow, you know, this really kicked me in the pants on day 3 and 4 and 5. But by day 8, I was feeling pretty good. I really felt like I could do kind of my normal activities and not have to worry about how I felt or what I was eating or anything like that. I had my taste back, those kinds of things. And it should follow that suit each time. So then you can plan, which empowers you, right? So then you know, okay, I can tell my friends I will go out to eat with them on day 8 after chemo. But if they want to go out for a weekend or a weekend movie or something and it's day 3 or 4, you might think twice because you might fall asleep in the theater. So it's just simple things like that. So make sure you talk to your doctor about the side effects, make sure that they have heard of them and that they can help you with those. Okay, next slide is all about next couple slides is getting your house in order. So important tools that help you with common concerns. Okay, so living will, advanced care directive, durable power of attorney, financial power of attorney, do not resuscitate documents, and wills. They're all defined here. There are differences between all of them. This is part of getting your house in order, I call house. And it doesn't matter what age you are. You need to know who can take charge if you can't. Who knows your wishes if you can't speak? You never know how this journey will run. So get these things in place so that decreases your worry and stress. You know that somebody's got your right hand, or you know where that person, and that person then, which we'll get into caregiving in a minute, that person then feels empowered to help you because they know what your wishes are. They feel confident telling your doctor, hey, this is what they want, and they just can't tell you that. That kind of thing. So it's real important to get these things in place. And there are resources to help you with this. Cancer support community would be great at that. And same with Cancer and Careers, a lot of financial resources out there for getting documents like this done. And that's the other one. So, and now we get to caregiving. So the best way to help the person going through cancer treatment is to listen. Listen and listen and listen some more. They don't necessarily need you to fix something. They just want to let their feelings out, so let them talk in their time. And some don't want to talk about it at all. So it's important to slow down, think things through, don't feel rushed. Remember, I talked about it earlier on in this presentation that a day or a week doesn't make a huge difference. So take that time with your loved one and make sure that you both feel confident and know what is expected, because it'll give you a greater sense of control, but it also gives them a greater sense of control. And then in turn, you're both going to be calmer. Take time to ask questions, think through the steps, and partner with the medical team to develop that treatment plan for your loved one. So get involved. So if you notice things, I will say that my husband noticed things about me going through chemotherapy that I didn't even pick up on. I knew, my brain was just a little slow. But he actually noticed that I talked slower. And he also noticed when chemotherapy was done, and a couple weeks to months later, then I started to sound more like myself. Not quite so slow, and I could find the words again, and little things like that that kind of happen. So they can be your mouthpiece too. I mean, you may know what's going on, but it's also good to hear what they observe. They may observe things that you're not even picking up on. They may notice that you're tripping and you may not even notice it. You just may think, oh, I'm clumsy. But they may notice that, hey, you weren't tripping before and now you're tripping. You're getting, your feet are not walking and your energy level is low. You may not see that. You just may be like, oh, I'm watching my shows. I'm just getting caught up on all those movies I wanted to watch. No, they're going to notice that you're just sleeping a lot, or they'll be a better judge of that, honestly. So that's important. And then the next slide, it's important that you take notes for yourself and your loved one at these visits. So even if you're doing it virtually, take those notes. Compare notes after each appointment with what they heard versus what you heard. And I can tell you they will differ. And so you may miss something. That's again why I encourage you to do those recordings, because then it isn't the, well, you're wrong. He didn't say that. Yes, he did, dear. Yes, he did. I have these conversations with my own husband. He's like, no, you misunderstood. They did not say that. And I wish there was a recorder, because I was like, I was pretty sure. But then come to find out at the next visit, when we said, hey, what did you mean about that? He was probably right, and I probably wasn't. So anyway, make time to care for yourself and ask for help when you need it. So take a break. It can be exhausting taking care, and it is exhausting to see your loved one not feeling well and not being able to help them. So take a moment for yourself to just regroup. And if that means you can't possibly leave because she's feeling too ill, maybe you take a break, take a walk, have somebody sit with her while you're taking that walk, or ask somebody to bring in a meal because you just don't have the time. You might be trying to work a full-time job and take care of your loved one. So whatever help you need, people love to help. They just don't know what to ask. They don't know what to do. So make sure that you are being vocal, and it's okay to ask for help. Next slide. So taking the next steps. So be selective as to where you find your information. I kind of alluded to this already. So use proven, reliable resources. Again, there are numerous ones out there, but the ones I always recommend are the cancer.gov and American Cancer Society, and some of the more cancer-specific ones, like breast cancer in general. There's just more of us out there, unfortunately, but we also have a lot more of those resources, like Pink Ribbon Connection, or and Little Red Door is helpful as well if you're in Marion County. I think they've extended some things, services beyond that too. But transportation can be helped with these American Cancer Society or Little Red Door. They do offer some assistance with that. Benefit from the experience of others. But here we go again. But remember, your path is unique. I can't say it enough. I tried to buddy up with people I didn't know before breast cancer, people I did know before breast cancer, and they were on different paths. So while one of the friends, that was a friend of my brother's who lives in Seattle, I talked with her. She was a great motivator. She had a similar treatment, like she was going through chemotherapy a couple weeks ahead of me, and then she was going to have her surgery. And we were kind of just like a couple weeks behind each other in what treatments we were getting, although they were different treatments, but like the actual basically chemotherapy followed by surgery. And she was a great motivator, and she was a great tipster. So she helped me with that. She'd send me little care packages, and I just knew that if I was coming unglued, she could help me. Another gal that I buddied up with was from Chicago. Heard of her through a friend, and she's like, oh yeah, she went through breast cancer, and she's about your age. And again, wasn't the same type of breast cancer, but again, we connected. And the one thing that I will say with her is we both had that same type A personality. So it was really hard for us to let that control go. We talked about that fear of reoccurrence that doesn't go away but lessens with time. We talk about that, and we talk about what that would mean for us and for our families. So while those two women had breast cancer and went through different treatments, they still offered me some great experiences that I used in my own journey. But I did not take the path. I didn't take like, okay, I had this chemotherapy and I was sick as a dog. I didn't want to say I'd be sick as a dog, because maybe this chemotherapy wasn't going to work that way. Maybe I'd be fine. So it's those kind of nuances that's unique to you. And then choose a doctor you can trust. Feel comfortable opening up and communicating. I have been in many a room where I have been shocked at what people will say, and then shocked by what people don't say. They really trust their nurse navigator as going through that journey. And so there will be times we'd be sitting in a room and listening to the doctor, and then they'd walk out of the room and all of a sudden all these questions would come up, and I'm like, why? I mean, I will answer them. I'm more than happy to answer them for you, but your doctor should be the one. And sometimes there were questions I really didn't feel like I should answer, and I would rope that doctor right back in the exam room and say, hey, come in. We got more questions. Come on in. So trust someone on your care team to answer those questions and be comfortable. Because if you are, you will go through your treatment better. You will be more confident. And with that, you will have less anxiety. I promise you. So now we can do questions, or Rachel is going to talk about the cancer support community resources, and then we can do questions.
Awesome. So I'll go through these last couple of resources pretty quickly, but we have, of course, our cancer support helpline. So this is staffed by licensed professional counselors to assist you with a variety of questions. Seriously, the helpline is really great. So don't be afraid to reach out for any questions that you may have concerning from treatment to your mental health to caregiving to anything, everything. And then, of course, we have our Cancer Experience Registry. We'll talk a little bit more about that one here in just a minute. Another great opportunity and a resource to you is Open to Options. So this one is, we have specialists that can help create a written list of specific questions. So like Lynn had mentioned in the presentation, if you have a specific event, or if you really want to be at your child or grandchild's graduation, their wedding, whatever is important to you and how you can get to that, but you're not really sure what kind of questions to ask or how to even get to some of those questions, this Open to Options is really great because they'll help you with those specific questions. Like, okay, if I'm trying to make it to this specific event or date or something that's important to me, can we do this instead, or can we do this? So it's really great to be able to kind of have somebody to walk through that with you. And then, of course, our Frankly Speaking About Cancer series. So you're taking part in the educational series tonight. So we have a variety of ones just like this one. Some are cancer specific or some are more broad, like our program tonight. And then, of course, our Cancer Experience Registry. So if you haven't heard about this, it is a research survey to identify and understand emotional and social needs unique to each cancer experience. So it helps inform medical professionals about patients' need to improve their quality of care. And of course, it's confidential and secure. And the really great thing about this is that they take this data and they take it to medical professionals. They take it to Capitol Hill and say, these are the bills, these are the things that we need to take seriously. People are really suffering from this type of treatment, or they need a lot more financial assistance. Whatever it may be, it actually gets used to help improve that quality of care. And so here are some of the different cancer registry that are online with some different timelines there. And of course, how can you join? Well, cancerexperienceregistry.org, you can go there and you can register in 3 simple steps. And then you fill out the survey, which is personalized to your experience. They'll ask a bunch of questions, but like I said, it gets you put to a good use. You set up your personalized page, and then of course you can check back for other educational resources. Maybe there are other new surveys, other ways to help improve quality of life. We do have our grassroots movement as well. So if you are really wanting to advocate not only for yourself, but for others, this helps do that. So that helps ensure that people touched by cancer have an access to quality, comprehensive cancer care, and includes that social and emotional support. So this community helps provide the opportunity to get up-to-date information. They're part of the network that interacts with Capitol Hill. Your voice will be heard alongside of voices of several other many cancer patients and loved ones. And if you're interested in more in learning about that, there's a link there, but I can also send that to you as well. Another really great resource is my Lifeline. So this one, if you've heard of Caring Bridge or some other websites like that, this is super similar to that. It's an interactive blogging and updates center to let your family and friends know how you're doing. They'll email you updates. It has a calendar, so if you're needing help with meals or cleaning, pet care, child care, whatever it may be, it has a nice little calendar on there, and you can just type it in, and then people can go in. They can pick what they want to help with and go from there. It also has a lot of different discussion boards, so you can connect with others. Your care coordinators makes it easier to assign, again, helping family members and caregivers and other people that want to help. It helps them know how to help you. And of course, you have the privacy control so that your cancer experience is personal, and it ensures the right people have access to comment on your site and volunteer to help you out. All right. Any questions or anything else? I'm going to stop sharing my screen so we can answer any questions that you guys might have. Feel free to use your chat. We'll keep this up for just a little bit if anybody has any questions. Now, Lynn, if somebody has a question after tonight, is it okay if I connect you with them so they can ask any questions to you?
Oh, absolutely. Yeah.
So I would definitely be one of those people that would forget about it or think of something later.
Yes, me too.
All right, so we have a question. When making a treatment decision with a caregiver or loved one, what is the best way to have that conversation?
Say it again. When making a treatment
decision with a caregiver or loved one, what is the best way to start that conversation?
So it would depend on who that is, of course, but if it's an adult child, it will be a different conversation. If it's a parent or a husband, obviously different conversation, but it depends on who that caregiver is. But I think it's important for them to know what you want to get out of your treatment. And you may not even know what that is, but you know what's important to you deep down, your core values of, keeping that normal life that you have, working full-time, that's important. Or I really don't think I can do work full-time. We're going to have to make some adjustments here. And that might be a budget adjustment. That might be caregiving adjustment, like if you have young kids, things like that. So that's where those treatment decisions come in. And it may be that your spouse works certain days of the week and you work certain days of the week. Your treatment's on a certain day of the week. And so you're going to need support on treatment day and maybe the couple days following. So how you coordinate all that is really a good basis of the treatment that you're going to get. And when I say treatment, it's that vague, overreaching definition. It isn't like this particular drug, this particular regimen. It's really how are you going to make all of those decisions fit into your current lifestyle, or what modifications do you need to make, if any, in the treatment or when it's being given, things like that. So that's how you start it. You just let them know what's most important to you. If it's work, maybe I can't miss work. I can't miss work. I got to figure out how to make this work. Maybe you talk with your family member and say, I'm going to need help. I'm going to need help. I'm not going to be able to work all day and then come home and fix dinner.
Mm-hmm.
But work is very important. So, conversations like that.
Yeah. Thank you. Any other questions from our attendees tonight? All right. I don't see any coming in through the chat box or through our Q&A. So again, if you do have any questions after tonight, feel free to reach out to myself or someone at CSE, and we can get you connected with Lynn. We're happy to do that. And remember to fill out your surveys, because those are super important for helping improve our education programs overall, and then of course to send to our headquarters. So again, any questions, feel free to reach out. Thank you so much, Lynn, for being here tonight and for helping us provide this education program. It's super informational, and there's a lot of information, but I know it's just so good to have some of those resources and the questions to ask and all of that. So we truly appreciate you.
Okay, thank you. It was an honor.
Yeah.